Our group is analyzing the mission of the University of Louisville School of Medicine. The School of Medicine has a rich 175-year history and has graduated more doctors than any other institution in the state of Kentucky. The School of Medicine has always been a leader in clinical training and is continuing to move towards an emphasis in research to meet the goals of the University of Louisville School of Medicine. In this report, we will analyze current challenges faced by the school and future opportunities for improvement.
By voluntarily exceeding accreditation standards, the School of Medicine is abiding by their mission of excelling in the education of physicians. One of the mandates for the School of Medicine is exceeding the accrediting body's standards for undergraduate medical education, LCME, graduate medical education, ACGME, and continuing medical education of physicians, ACCME. By April 2013, the LCME will conduct a thorough review of every aspect of the medical school's function, ranging from missions to curriculum to research and institutional standards. Reviews like LCME occur regularly every 7 years to ensure that graduates possess the skills and experience necessary to provide an exceptional level of patient care.
The preparation for the LCME process is very much strategic planning, and we have now what is a 5-page timeline on exactly how to do it, and that timeline is in, and the activities are informed by what we have learned from previous visits. There is a real necessity to meet with anyone that you're asking to do something so that they understand it, to check with people, etc. And strategically, we have learned from mistakes and then have implemented changes in the procedure to attempt to make it as successful as possible. And that has worked well.
By contributing to the number of physicians in underserved areas, the School of Medicine is addressing issues important to stakeholders, including the residents of the state of Kentucky. The school recognizes its purpose in serving the state with health care and takes the medically underserved into consideration when making decisions. The school works to increase physicians in underserved areas through the Area Health Education Centers, AHEC. AHEC are designed to bring first-class medical care to the vast majority of Kentuckians in areas that are either rural or underserved. In this program, medical students are trained at these areas of the state for 4 weeks in the hopes that they will choose to work there after graduation. The Trover Clinic in Madisonville, Kentucky is a state-supported medical facility that partners with the school to help train students in rural medicine. The School of Medicine also recruits students from rural areas of Kentucky in an attempt to increase physicians in these areas. The Rural Admissions Initiative states, although not extensive, the available literature supports the concept that medical students from small towns are more likely to practice in small towns after completion of their training.
This year we started doing clinical rotations, one of which I did at Trover Clinic in Madisonville, Kentucky. It's part of our AHEC rotations. We do them for a couple of reasons. First, I did it at Trover just for more hands-on experience. Down there's only a couple general surgeons, and there aren't really any residents. So as 3rd or 4th year students, we can go down there and get treated like interns or residents. So we get more hands-on experience both in the clinics as well as in the operating room. So that's one decision to kind of make you go down there. The other one is it serves a different patient population. There's a lot more of the underserved population down there, a lot of uninsured or Medicare, Medicaid patients that you'll see in the clinic, and there's a lot of farming. So some of the patient plans or the things you come up with take a lot of that into account of whether the parents can work on the farm or whether kids can do it. So you kind of have to change up, your plans for patients, which is kind of an interesting thing to see.
The School of Medicine seeks to increase the diversity among graduating physicians. Pipeline programs exist to target and groom underrepresented groups for enrollment at the school. These programs include the Summer Medical and Dental Education Program and the Professional Education Preparation Program. Increasing minority physicians has a large community of stakeholders, the world. This group of stakeholders are the recipient of discoveries and research produced by the future physicians and researchers graduated by the School of Medicine. Increasing the pool of talent by increasing the diversity of the pool offers more potential views and multidimensionality. The School of Medicine has a distinct interest in the University of Louisville's mission to become a premier, nationally recognized metropolitan research university. The School of Medicine has put a great deal of emphasis on having a research focus, seeing its role as a vital component to the university's quest. The issue is, how does the school generate funding to recruit additional faculty to conduct the research? They also need to continue to gain National Institutes of Health funding in order to support the faculty with new salaries, new equipment, and additional research buildings.
The overall focus of a university is not only to teach students, but also to promote the acquiring of knowledge. And so to that extent, that part of the mission statement is completely consistent, not only with the medical school, but the mission of the university at large, and so it completely makes sense. From my standpoint, traditionally, medical science has been advanced at medical schools, and for that reason, it's entirely consistent that you would want to have a first-rate research enterprise at any medical school. And that does two things. First, it advances knowledge for the betterment of everybody, the world as a whole. And secondly, it informs medical education itself, because the excitement and innovation that comes from that kind of research percolates down through the faculty into the students and residents that are being trained here. The building that we're sitting in is a gorgeous example of that. It is absolutely a top-flight research building, state-of-the-art in every way. So that's a good place to start. Is there actually a physical place to do the kind of research that we need to do? So that's one element. The second element is administrative support and financial support for our research enterprise. And in both senses, those have been very well supported here. You can sense that the administration, through the Office of the Vice President for Research, is doing whatever they can to ease the administrative burdens on researchers and give us the resources we need to overcome administrative hurdles whenever possible, so that's great. The James Craig Brown Cancer Center has provided an enormous amount of material support for the research enterprise here as well. So there's that, and then there's another component, which is the atmosphere among my colleagues here, which is really extraordinarily good. This is a very collaborative environment. It's not one of the larger research institutions around. And that has a big advantage in a sense, because there's a very collegial atmosphere here, a lot of collaboration, and a lot of interaction among researchers who come at research from a number of different perspectives.
The relationship between the School of Medicine and University Hospital is critical for meeting the goals of the school's mission statement, specifically in relation to patient care and community service. University Hospital is also vital to the clinical experience of the students, who play an integral role in the function of the hospital, further solidifying the link between the school, hospital, and community. Throughout the rotation portion of their training, students will gain their first real-world experiences with what they have learned in the classroom in a clinical setting. Without University Hospital, the school would have little tangible evidence of its impact on the community. University Hospital has become a weakness for the school. The funding for the hospital is insufficient, and they have been searching for a financial partner. On November 14, 2012, a partnership was announced between University Hospital and Kentucky One Health, a part of Catholic Health Initiatives. State Attorney General Jack Conway said the agreement will infuse $1 billion into the hospital, which will help its financial issues. This partnership is critical for the hospital to continue to serve the indigent population of the surrounding community and to educate the students to a higher standard of excellence.
partnership sounded like a great idea because it lets us continue to do the things that we're best at as an academic hospital and to really contribute to the network that we're joining, because we do have expertise and care pathways and other contributions, not least education, that we can contribute. And at the same time, it lets us improve our own financial health to the point that I know the stability will be there so that I can build continued growth into the educational program. I think that for the last 3 years, any discussion that concerned medical education, especially the clinical part of medical education once they leave the classroom, has always broken down when we got to the point of actually implementing anything, because there was so much financial uncertainty, and because even down to physician leadership, we had some great physician leaders that were leaders in education, and they haven't been able to stay because their clinical practice couldn't be supported anymore financially by the joint enterprise. So I think ultimately the impact of the partnership is that it's going to be very good for education. I do anticipate, just based on my prior interactions with health networks that are not used to a primary educational role for their physicians or for their nurses, that there will be a little bit of adjustment as that corporate culture learns how to still work effectively and give great patient care, which always comes first, remain financially healthy, but also allow time and space for education and understand that that's just a different form of productivity. I think that's something that'll continue to be very much on everyone's mind, that I know that Dr. Dunn and Dr. Hansel will be working on closely with those people. We're lucky that we have leaders that really understand business and also really are very focused on education.